get us started. Okay, so good evening and welcome. I'm Nikki, I'm part of the Wellspring Alberta team, and we are so pleased that you could join us for tonight's speaker session, Living Your Best with Advanced Metastatic, Chronic, or Non-Curable Cancer, Integrative Oncology with Dr. Linda Carlson and Dr. Sophia Karim. We proudly provide this program in partnership with Cancer Care Alberta. And with that, I'm gonna pass it over to Linda and Sophia.
Great, thank you, Nikki. And it's a pleasure, as always, to be here with the Wellspring audience to share with you today. So today we're going to talk very broadly about integrative oncology within the context of living your best life with more advanced cancer, as we've heard. And so here's what I'm going to cover. Let's see if we can get this to move. There we go. What is integrative oncology? So first, a little bit of defining the terms here. And then I'm going to talk about mind-body therapies in cancer. Oh, I didn't introduce myself. So Dr. Carlson, I'm a clinical psychologist and a professor in the Department of Oncology at the University of Calgary Cummings School of Medicine, and also work at the Tom Baker as a clinician, actually offering some of these mind-body therapies I'm going to talk about. And then Dr. Karim is going to talk about diet, exercise, and natural health products and dietary supplements. And we hope to leave at least a half an hour for questions. I often like to make these experiential, but there's a lot of information today, so it will be a lot of listening and taking in information, and we will share the slides with you afterwards as well. Okay, so let's start with a few definitions. Complementary therapies. These are interventions, products, and procedures that are not traditionally part of conventional medical care, but they're typically used alongside conventional care. So you can think about things like natural health products, the mind-body therapies. We're going to talk about exercise, nutrition, different energy therapies. It's important to know these terms because we distinguish complementary from alternative therapies. And these are interventions that are chosen instead of conventional cancer care. So these are usually not evidence-based or well-researched. Often they can be very expensive, or they require travel to different parts of the world, you know, these clinics in Mexico, that kind of thing. That's not what we're talking about when we talk about integrative oncology or integrative therapies. It's more the complementary approach. Okay, so we're going to do a little survey here. Now that we know what complementary therapies are, what percentage of people with cancer do you think use them? So you can put your answer in the chat. Less than 10%, that's A. 25%, that's B. About 50%, that's C. And 75 or higher, that's D. So why don't you just throw a few answers in the chat, and I'll just take a quick peek. I see B, A, D. Oh, I'm seeing a little bit of everything here. D, D, C, A, D, B. Well, yeah, so a lot of people think it's quite high. I've got quite a few B's at 25%. Oh, a few more B's coming in here. Someone here, A, thinks it's less. Well, you're in the right ballpark, and the actual answer is, whoops, now I can't get my mouse to go. Here we go. Ta-da, the answer is C, about 50%. So this comes from studies around the world, 18 different countries. The prevalence of using complementary therapies since a diagnosis of cancer is around 46% worldwide. In Canada, those numbers are about the same, 48 to 50. We did a survey at the Tom Baker back in 2012, and at that point it was 47% of patients using something. And people more likely to be using complementary therapies were women, younger people with higher education, and a longer time since diagnosis, so living with cancer longer. No surprise if you look around the audience today, many women, no doubt about that. And the most commonly used things are natural health products or the dietary supplements, with over 70% of people using complementary therapies using those ones. Why were they using them? To improve their quality of life, to enhance or strengthen the immune system, to increase feelings of hope. And for some people, they were hoping these would help cure their cancer. Okay, so integrative oncology is another term I'm throwing at you here. And here's another little multiple choice question here. What is integrative oncology? So same thing, you can throw your answer in the chat. A, it's the newer term for complementary and alternative medicine. B, it's a term used by non-physicians to promote use of natural supplements in combination with conventional oncology treatments. C, it's a means to integrate a variety of conventional cancer treatments, including systemic therapy and radiation therapy. Or D, it's a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications. So go ahead, you can throw your answer in the chat. We'll see what kind of things come up here. Oh, I'm seeing a lot of D's. Oh, there's one A. Well, A is similar to D. Yeah. D. Oh, you guys know where I'm going with this. So yes, the answer is D, and a little bit of A too as well, actually, because it has replaced the term CAM, or complementary alternative medicine. So the official definition is included in D. So here it is, a patient-centered, evidence-informed, exactly what I just said, utilizes mind and body practices. And the second part of the definition is that integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum. So that means sort of from prevention right through diagnosis, treatment, end of life. Become active participants before, during, and beyond cancer treatment. So within integrative oncology, there's three major groups of therapies: lifestyle modifications. Those are things like exercise and whatnot, mind-body practices, and the natural products you've heard me mention. But those are utilized based on the factors in panel B. So the values of patients, their preferences, their right to choose, the research evidence showing what interventions tend to be effective for different symptoms, and clinical experience, both of patients and the healthcare providers. So all these things are taken into account when a good integrative oncology plan is derived. So as I said, in the three main areas, there's lifestyle modifications. So that's exercise, physical activity, diet, also sleep and stress management. We consider these the foundations of wellness. The different mind-body therapies. I'll talk to you, kind of going to do a big high-level survey of the different mind-body therapies. So meditation, yoga, acupuncture, Tai Chi, Qigong are just a few. And the natural health products, vitamins, minerals, different herbs, botanicals, special diets, those kind of things. So I want to refer you to a really, really helpful book in this area. If you haven't seen it, I really highly recommend it. It's called Anti-Cancer Living. My colleague, Lorenzo Cohen, and actually his wife, Allison Jeffries, he's at MD Anderson Cancer Center. And these are the 6 protective factors that are covered in this book. So diet, physical activity, stress management, sleep, love and support, also very important factor in doing well with cancer. And they also cover a lot about how you can arrange your environment to avoid exposure to different toxins. And another resource that I highly recommend based on this is called the Anti-Cancer Lifestyle Program at anticancerlifestyle.org. It's a really great resource. They have on-demand videos, live programs that cover all these different areas. Okay, so mind-body therapies. I'm going to take a look at my watch too, because I'm going too slow, I think. What are mind-body therapies? So a variety of techniques designed to enhance the mind's capacity to affect bodily function and symptoms is one way to think of it. And they recognize that everything's interconnected. So your nervous system, your hormonal system, your immune system, even your gut. So and I like to say sometimes that every state of mind has a state of body. You know, so when you're feeling anxious, it's reflected in how your body feels. Your muscles become tense, your breathing speeds up. You know, when you're relaxed, the same thing. So why are these things popular? They're, as I said, used by many cancer patients, people with cancer, for reducing symptoms across the gamut of kind of common symptoms people experience, like stress, anxiety, pain, fatigue, sleep disturbance. Whereas traditional medical management of these symptoms often involves pharmaceuticals, or taking different drugs. So analgesics for pain management, stimulants to help you feel less fatigue, sedatives to help you sleep, antidepressants for mood, et cetera, et cetera. Many people prefer not to take these medications. They may interact with other medications people are taking, or they often hear people say, I've had enough with the drugs, and they may have unwanted side effects or dependency. So many people prefer these non-drug alternatives. So what are the different mind-body therapies? The main ones that have been studied within the context of cancer are meditation, and specifically mindfulness-based approaches, which I'll talk more about in a moment. Yoga is also very popular. Hypnosis, relaxation and imagery, and different creative therapies. So these are where we use the arts to help express emotions and sort of cope with difficult things. So they can be music therapy, either making or listening to music, visual arts like drawing, painting, sculpting, writing, as well as dance, movement therapy. Now, other therapies that are nowadays more included as mind-body therapies, but used to be called more like energy therapies, are things like acupuncture. And these come from traditional Chinese medicine, actually, thousands of years old. So acupuncture is inserting very small needles in different parts of the body called acupoints. Tai Chi and Qigong are both sort of derived from martial arts, where you've perhaps seen photos like this one on the bottom here of, people doing a very slow, deliberate practiced movements, usually combined with a breathing pattern or technique. Reiki or therapeutic touch. This is where you are lying on a massage table sort of thing, and a Reiki therapist will place their hands right on the body and hold them there for a fairly long period of time. And the idea is to transfer energy through the Reiki practitioner into the person. And it helps to manage different symptoms and, improve energy levels and things like that. And reflexology is where it's almost like acupressure on the foot, the base of the foot. So the different organs of the body are mapped onto the sole of the foot, and the practitioner produces pressure in different parts of the foot to help relieve certain symptoms. Okay, so I'm going to kind of go through each one of those, hopefully fairly rapidly, and tell you what the evidence tells us that they're useful for. And so one of the most strongly evidence-based treatments for a range of symptoms is meditation, or specifically mindfulness meditation. So there are other forms of meditation like transcendental meditation, or meditation that comes from different traditions. Most of the research stems from programs that we now call mindfulness-based interventions, but they're based on mindfulness meditation. And many people have heard the term mindfulness. I've given many talks here, you may have heard them, but it's useful to understand what we mean when we say mindfulness. So the definition is paying attention on purpose in the present moment with an open and accepting attitude. So mindfulness is two things. It's a way of being in the world, right? You can be more focused and present no matter what you're doing, washing the dishes, walking your dog. So you can be more or less mindful. It doesn't take extra time. But it's also a practice. And the practice helps to train us in the mental capacity to be mindful, because it's difficult to just say, okay, I'm going to be mindful when you've spent a lifetime worrying about the past or reliving the past, or, ruminating about things or worrying about the future. And so it's training our minds to come to the present moment and remain there. So this cartoon illustrates that mindfulness is a way of being in the world. And I always say, who's winning here? Is it the human or the dog? And clearly you can see the dog's just thinking about exactly what's in front of it. The dog's in the moment, whereas the human brain is full of all kinds of other things. And this illustrates the practice of mindfulness meditation, how we can train ourselves to be more mindful. So let's look at the evidence for some of these different mind-body therapies. So I always like to turn to the best journals, and we have published a treatment guideline. This one came out specifically for breast cancer, but we've done more recent ones across all different cancer types, and the recommendations are fairly similar. And so the way these clinical practice guidelines work is that a group of experts review all the different studies that have been done, there may be hundreds of them, and boil it all down into a recommendation. And the highest grade here is grade A, just like your marks at school, and then it goes down. So mindfulness-based stress reduction or mindfulness-based interventions are highly recommended for mood disturbance and depressive symptoms across the board. It's also recommended for reducing anxiety and for improving quality of life. So there are many mindfulness programs through Alberta Health Services, and of course through Wellspring as well. So if you go into the course catalog at AHS, you can sign up for a course I teach in mindfulness-based cancer recovery, and you can also take it at Wellspring. And there's many mindfulness apps. For example, if you don't feel like a sort of multi-week course. So usually there are 8 or 9 sessions once a week for a couple of hours, and you practice at home. But there are online programs, there's many apps, and I'm happy to direct people to those afterwards. That's the pamphlet. Okay, so what about yoga? Is it a relaxing pastime, a spiritual path, or an extreme sport? And I love this because there's many misconceptions, as there are around mindfulness, around yoga. You're going to be wrapping your leg around your head and that kind of stuff. Well, the yoga that's done for people who have cancer is what's called therapeutic yoga or restorative yoga. It's a very gentle approach. It employs movement, the breath, and some mindfulness practices. It gives you the tools to regulate your autonomic nervous system, so balance within the nervous system in the body. And yoga, in fact, means union or balance between mind and body, between the individual and the larger whole. So there's many different styles of yoga, And it's useful to look at a couple of dimensions, so sort of the physical intensity scale and the spiritual scale. So for example, some are easier in terms of intensity and some are more strenuous. So the physical elements are the poses, the exercises, the stretches. So the easier types are what we usually recommend for people going through cancer treatments or post-treatment. And as I said, the therapeutic restorative. The more strenuous types are more like Ashtanga or power yoga or Bikram hot yoga. There's many different forms. And then also some incorporate more meditation or breathing exercises called pranayama. So some are it's much like sort of like going to the gym and doing exercises. Others, may use chanting and breath work and that kind of thing. So it's useful to understand what kind of yoga you're getting yourself into before you sign up for a class. If we look at these same clinical practice guidelines, we see yoga recommended for reducing anxiety. The evidence isn't quite as strong as meditation, so it gets a B, but it is building. And also for improving mood and depression symptoms and quality of life. So very similar outcomes. So when you're choosing, do I want to learn to meditate? Do I want to do yoga? Largely it's up to you, because a lot of the evidence just compares these interventions to doing nothing or usual care. Very few studies have compared them head on. And yoga has also been looked at for helping treat fatigue, which is a really major problem for many people. So we have wonderful programs in Alberta called Yoga Thrive, and this is a research-based therapeutic yoga program for cancer survivors and support people. It's a 12-week program, twice a week. It's modified specifically for people with cancer, and research shows benefits on mood, stress, physical strength, quality of life. So you can look up Yoga Thrive on the internet through the Faculty of Kinesiology. I believe also Wellspring offers Yoga Thrive programs, and there are many trained yoga therapists in community-based yoga centers as well. So you can ask, do you offer Yoga Thrive? If you can even call your local yoga studio. So relaxation therapies, moving on. These elicit a state of freedom from mental or physical tension, literally relaxation. And another actually point to consider, I may as well interject here, is when you're choosing what to do, is the degree of engagement that's involved. So some are very active, like learning to do yoga. Other mind-body therapies are more passive, like relaxation or imagery, where you can relax. If you're feeling really fatigued or you have a lot of symptoms, relaxation with some imagery might be a really good way to help you feel better. So symptoms are resolved as a result of eliminating physical tension, emotional stress, and they can also help with sleep. So there's a number of different relaxation approaches. One's called the relaxation response or progressive muscle relaxation. There are many free guided relaxations you can find on the internet, even if you just search for those terms. And what they do is decrease the fight or flight response in your body. So your muscle tension decreases, your blood pressure goes down, your heart rate goes down, your breathing rate goes down. Guided imagery is often combined with relaxation. So often there's a relaxation sort of induction, and then guided imagery is just bringing pictures to your mind, but also you can use other senses like smells, sounds, touch. So it's engaging the imagination to create the sensory experience. And usually it's with a clinical goal in mind, like stress reduction or sleep, that kind of thing. So examples are going to your happy place or your safe place, bringing all the senses in. Or you can use it to specifically manage symptoms, like imagining a thermometer if you have pain, and it's hot and red and you can feel it going down, 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 as if the heat is decreasing until you feel icy cold. So that's a way to use imagery too. And studies have shown that it's effective for managing depression, anxiety, discomfort, quality of life, and helps with pain. Now, hypnosis is really just taking this a step further and also can really help with pain. And I like the cartoon because this is, again, another myth, right? When you awaken, you'll feel fresh and relaxed with no memory of changing my light bulbs. So there's this idea that you do things under hypnosis that you wouldn't normally do or you wouldn't have the capability for. And really, it's not that way. A person has to consent to medical hypnosis, but it's a natural state of attentive focal concentration that can be induced with the help of a hypnotherapist, or that you can do self-hypnosis. And usually it's aimed at achieving symptom relief. It tends to be quite goal-oriented and focused. And it's actually the most common, well-evidenced form of non-pharmacological pain control. And I'll just give you an example of one study here that's really interesting. So women undergoing breast biopsy, before they had their surgery, half of them got just a brief 15-minute hypnosis session telling them they weren't going to feel any pain and they're going to recover quickly. And the other half just had a conversation with a nice person, actually the same person, for the same duration, but there was no hypnosis or suggestion. And it turned out that the women who had the hypnosis, they had less pain, discomfort, fatigue, less distress right after the surgery. It was just one 15-minute session. And they also needed less time in recovery room and had decreased cost to the institution. So it just shows you how powerful some of these therapies can be. And that's just the reference. And then let's talk about the creative therapies. So these provide a means to integrate physical, emotional, and spiritual elements. They facilitate creative ways to express emotions, process difficult feelings. We know it's never a good thing to suppress emotions. And so finding healthy outlets for them, like creativity, can be really great. So as I said, music therapy, visual arts, expressive writing, journaling, dance, any of these ways that allow you to express emotions are great. And this is a study of music therapy. So people undergoing bone marrow transplantation, they listened to music and participated in music and had decreased anxiety, depression, and mood. And when you compare them to other active interventions, again, they seem equally effective and perhaps not superior, but also good. So a couple more before we move on. Tai Chi, or Tai Chi Chuan, as it's traditionally called, as I said, comes from traditional Chinese medicine. And you learn a series of very slow, specific movements that are called forms. They're done in a meditative, meaning focused, present moment kind of fashion. You focus on the movement and it brings about a sense of calm and clarity. And so the practice began as a form of martial arts training, but now it's used as a health practice. And studies in elderly people show it improves balance and prevents falls. And also we see quite a few studies in people with cancer showing similar outcomes and also helping to improve mood and whatnot. Qigong is a simpler practice than Tai Chi. So often we modify Tai Chi, or we combine it, make a hybrid of Tai Chi Qigong. So the movements are simpler and not as difficult to learn. This is around balancing Qi, which is the term for life energy. And so the idea is that you're aligning the breath with the movement and awareness. It's meant to be a form of exercise and healing. And so there's usually three components. There's a posture you take. So it can be a moving posture, but often it's just a still posture. There's a breathing technique that goes along with it. And there's an imagery about guiding the Qi around or through the body. And studies show it improves mood, fatigue, and quality of life. So this is a paper you can get that summarizes the most recent research on the mind-body therapies from my group, and really just summarizing what I've told you. So here's the different therapies, the strongest effects. You can see mood, depression, anxiety for many of them. The Tai Chi Qigong here has a bit more specificity, or has been studied more for fatigue and sleep. And then there's other effects that may be there as well. So imagery and relaxation can really help with nausea and vomiting. Cognitive function. People are starting to look at the sort of brain fog. We talk about quality of life, distress, anxiety. So this shows you that these different mind-body therapies can be very effective across symptoms. And as I said, which one you choose is really up to you. There's not a lot of specificity that we know now, except maybe the hypnosis is really good for pain. Another really good thing for pain actually is acupuncture. So as I said, acupuncture comes from traditional Chinese medicine, and you can see in the picture, there's really small needles inserted to different parts of the body. And where the needles go depends on what type of symptom you're trying to treat and where in the body. But acupuncture has been researched quite broadly for pain management. It has a relatively low risk of side effects and adverse events, and it's very safe. So this actually shows you a summary of guidelines that were recently published on integrative therapies for pain management specifically. And so what this is showing you, it's a little busy, but these are the different types of pain. And it shows you which integrative therapies are the most useful. And this just gives you details on how useful. So what I want to highlight here, though, is that acupuncture helps with this aromatase inhibitor related joint pain. So what that is usually breast cancer patients post-treatment for a very long period of time take things like anastrozole or tamoxifen, and that can cause joint pain, and acupuncture helps with that. general cancer pain, acupuncture, as well as some other therapies like yoga. We see guided imagery, reflexology here that I mentioned. CIPN is chemotherapy-induced peripheral neuropathy. So if you have the tingling and the pain and numbness in your fingers or toes, that's CIPN, and acupuncture can help with that, although it's very difficult to treat, and also surgical pain. So acupuncture is a really good approach if you're dealing with pain conditions. All right, so now I'm going to turn it over to Sophia to talk about diet, exercise, and nutritional supplements.
Great. Thanks, Linda. So my name is Sophia Karim. I'm a medical oncologist at the Tom Baker Cancer Center and have done some integrative medicine and oncology training as part of the Integrative Oncology Scholars Program. And so, yeah, looking forward to talking to you about the role of diet, exercise, and nutritional supplements in cancer care. Next slide. So Linda had this slide up before talking about kind of the three, big buckets of kind of integrative oncology. And so I'm going to be focusing on the first one in terms of lifestyle modification, specifically today on exercise and physical activity and diet. And then on kind of the third category on the right, dietary supplements, which includes vitamins, minerals, and botanicals or herbs. So let's chat about diet first. So diet is a common question, that comes up with patients who have cancer. And a lot of patients pursue kind of special diets during their cancer experience. And research on what diets patients adopt is almost non-existent. And so, looking at some common diets that were of interest to cancer patients, and you can see kind of, some of the fad diets have kind of changed. So in 2002, in order of prevalence, lots of vegetarianism, veganism, Atkins, the macrobiotic diet, the zone diet, the Pritikin diet, and the Ornish diet. In kind of 2022, 2023, again, vegetarian, vegan is common, ketogenic, macrobiotic, Paleolithic, Mediterranean, and the alkaline diet is sometimes brought up as well. Next slide. So this is a really good website and research institute that actually does a whole bunch of research on, diet in terms of cancer prevention, in terms of cancer survival. And they've done, numerous studies looking at kind of what are the main dietary ingredients or types of diet that really contribute to cancer prevention, but also, for patients who do have cancer, kind of, what kind of diets are they kind of promoting in terms of, feeling the best and living their best life kind of with cancer, understanding all of the different, factors that go into things that affect, your diet, such as taste changes and nausea, vomiting while you're on treatment. So what does the American Institute of Cancer Research kind of, say that is, good guidelines? So they really try and emphasize, 5 servings of vegetables per day, 5 servings of fruit per day, and emphasize kind of whole grains, and then beans, which are a really good non-animal based source of protein. On the other side, they suggest limiting alcohol, so less than, 2 a day for males and less than 1 a day for females. And that guideline, from Canada has actually been recently updated for both men and women to say less than 2 drinks per week. And that's, associated with a multiple other kind of conditions, but including, the risk of developing cancer, avoiding kind of all sugar sweetened drinks, as little as possible of kind of fast and processed food, and then limiting your red meat intake as well, and not eating any processed meat. And essentially that's kind of, boils down to trying to also maintain a healthy body weight, because we know a lot of cancers are associated with obesity. And so maintaining that healthy body weight is important for kind of prevention of cancers, but also is important in patients who have cancers and who are undergoing treatment, because we know that maintaining a healthy body weight will help you tolerate your treatments better, have that reserve in terms of tolerating some side effects from treatment. So, when we talk about processed meat, some people, ask what exactly is that? So that's any meat that's preserved by smoking, curing, salting, with the addition of chemical preservatives. And one of those is nitrate. So, some of the examples of processed meat include things like bacon, salami, sausages, hot dogs, luncheon meats, deli meat, pepperoni, and ham. And those types of meats have been characterized by the World Health Organization as carcinogens as well. So really trying to avoid those types of meats is really important in terms of diet. So this is a little bit of a busy slide, but this is kind of some of the research that the American Institute for Cancer Research has done in terms of kind of prospectively following patients who are healthy, kind of when they start following them. And then, of course, a portion of those patients will develop cancer and potentially pass away from their cancer. So what they did is they looked at, 361,000 participants, and they followed people forward. So they kind of, took them at a period of time, maybe 20, 30 years ago, and they followed them. And these were patients who were over the age of 60. They were from Europe, across kind of different countries in Europe. And they looked at how much these patients adhered to the recommendations that I just showed you in terms of eating kind of energy dense food, plant-based diet, limitations of red and processed meat and alcohol. And then they looked at how that impacted their cancer mortality. So how many of those patients who followed the diet versus didn't, died from their cancer, and then specific types of cancer if they died for them. So overall, when we look at cancer mortality overall, there was about a 6% decrease in patients who followed the guidelines versus those who didn't. And for colorectal cancer, it was about a 16% decrease, so a hazard ratio of 0.84. And for prostate cancer, again, it was about 6%. So overall, every additional point of adherence to those guidelines was associated with a 6% decrease in cancer mortality, which is quite, striking, actually. There are some dietary guidelines for patients undergoing treatment as well. And I like to point people towards the National Cancer Institute as well as the NCCN that can kind of, talk about nutritional guidelines, but also have tips on managing some of the nutritional complications of cancer. Like I was mentioning, the decreased appetite, the nausea, the vomiting, the taste changes, not really able to eat kind of large meals. And so there's some really good guidelines on that. And talking to a dietitian, of course, is really important when you're undergoing treatment. So how I discuss diet with patients, undergoing treatment. So we kind of emphasize the positive aspects and provide helpful resources of the diet that aligns with evidence-based dietary guidelines. So again, that's, mostly plant-based, but also that it has to kind of, agree with the patient's dietary strategies and also their kind of their background and what kind of diet they wish to conform to. And I try and remind patients that a strict diet might interfere with their quality of life, and a more adaptable dietary pattern might yield, longer, similar long-term outcomes. And so it's important to kind of, emphasize the importance of a well-balanced whole food diet. So when we're, sometimes when I'm asked about, should I go on a keto diet and things like that, we kind of look at the aspects of those diets that are good, but then we also try and say, if you're limiting yourself to really high fat foods and, not enough carbohydrates, then you may be lacking some of the nutrients that is really part of a well-balanced diet. And again, I always refer patients to a registered dietitian to really help guide their choices. This is a great slide, just looking at the various nutritional resources. So something from the AICR, something from Dr. Wayne Jonas, who we've worked with in terms of pocket guides. So you can have some little guides on exercise and nutrition. Exercise I'll talk about next. And then the anti-cancer lifestyle program, and then the 7 healthy habits, which include things like exercise and sleep as well. Okay, so let's move on to physical activity. So we know now that, any form of physical activity is safe and beneficial across all stages of the cancer continuum. So that goes from prevention all the way to survivorship. But unfortunately, very few cancer patients are active. And we see that only maybe 10% are active during treatment, and only 20 to 30% of patients are active after treatment. We know the numerous benefits of physical activity specifically in patients with cancer. So it improves self-esteem. We know that it improves depression and anxiety. It maintains muscle mass, reduces the risk of osteoporosis, can improve chemotherapy-induced peripheral neuropathy and lymphedema. Certainly lots of benefits with fatigue. And that's, one of the main things that I recommend to patients when they are experiencing cancer or chemotherapy-related fatigue. And we also know it improves balance and lowers the risk of falls. So again, kind of looking at cancer mortality, we know that every kind of amount of physical activity, and as you get more physical activity, your risk of mortality decreases. So when, you're kind of looking at the left hand of the slide here, someone who's sitting really, there's really no impact on kind of reducing their mortality from cancer. And then as you go to the right and as your dose of exercise increases, you get a more kind of substantial decrease in mortality risk, up to about, walking for about 700 to 1400 minutes per week, and kind of more running 240 to 450 minutes per week. So the risk of mortality on average kind of drops about 31% with just 2.5 hours of activity per week. So again, there are some really good guidelines. So this is for cancer prevention and for cancer survivors. So, greater than or equal to 150 minutes of aerobic physical activity per week. So that can be about, 30 minutes, 5 days a week. And then greater than or equal to 75 minutes of vigorous aerobic physical activity. And when we're talking about moderate intensity aerobic physical activity, that might be a really brisk walk, to the point where you may not be able to have a conversation if you're walking with someone. And then vigorous activity is things like, running or biking at kind of higher speeds. And we know that the activity should be performed in bouts of kind of greater than 10 minutes duration just to get that benefit. So again, it doesn't need to be long stretches at a time. You don't have to do 30 minutes at a time, but if you kind of did 10 minutes, 3 times a day, then that would get you your 30 minutes. And if you do that 5 times a week, then you're already at your 150 minutes. And those are kind of goals to kind of get to. So, when patients are starting, we don't expect them to kind of go from, sitting to going to 150 minutes of moderate activity per week. But it's, to get there in kind of slow increments and to work up to those goals. So similarly, we know that physical activity while receiving cancer treatment is really beneficial. We know that it improves quality of life, mentally, physically, and emotionally, decreases depression and anxiety, decreases cancer-related fatigue, and can improve lymphedema and chemotherapy-induced peripheral neuropathy. And when I talk to patients about, exercising, for fatigue, they wonder, they say, I didn't know that. I thought that if I was tired, I should rest more. And actually, if you try and incorporate some movement, again, doesn't have to be, and we don't recommend running a marathon or anything like that when you're undergoing treatment, but if you incorporate some movement, it actually does reduce your amount of fatigue. And that's been very well studied. So these are some brand new guidelines from ASCO, just recently published in the Journal of Clinical Oncology, to talk about exercise, diet, and weight management during cancer treatment. So this is a really good guideline. And this is the bottom line of that guideline. So oncology providers should recommend aerobic and resistance exercise during active treatment with curative intent to mitigate the side effects of cancer treatment. And then oncology providers may recommend preoperative exercises for patients undergoing surgery, specifically for lung cancer, because it's been shown to reduce the amount of hospital stay and postoperative complications. And then these are kind of evidence-based guidelines from Ontario for people living with cancer. So we know that it's safe to engage in moderate amounts of activity during or after treatment. Moderate amount of activity is recommended to improve quality of life. There should be maybe a pre-activity assessment to evaluate for any effects of the disease, treatments, or comorbidities. And I'll talk about a good program that does that actually. And people living with cancer are recommended to participate in physical activities in a group or a supervised setting. And we know that in a group setting, you're more motivated to exercise together, more motivated to be adherent to that exercise. And it should be included as an ongoing basis as part of your lifestyle. These are also some really good guidelines that come out of the American College of Sports Medicine. And you can see there on the left, it's a bit small and a little bit hard to read, but there is, strong evidence for cancer-related fatigue. And then it goes through what kind of the dose, of aerobic activity and resistance activity, or a combination of the two has been studied to improve those outcomes. So again, quality of life, anxiety, depression, lymphedema, physical function. And then there's some moderate evidence for bone health and for sleep as well. So this is, an exercise prescription I give to my patients just to kind of, getting them started with exercise when they have fatigue. So starting with, again, 5 to 10 minutes of light activity, 2 to 3 times per week, and then gradually increasing that up to what the guidelines kind of recommend. And so this is a really great initiative that we have in Alberta called the Alberta Cancer Exercise Program. So there are lots of exercise programs offered through this. I believe they're closed kind of for the summer, but they'll be back up again in the fall. There's virtual options, there's in-person options. I think Wellspring also has some ACE classes through them. So this is a really great program, and the person that runs it is actually a psychologist, but has done exercise training specifically for cancer patients. So finally, let's switch gears to kind of nutritional supplements. And we know that lots of patients, as Linda mentioned in the beginning of the talk, use or are curious about, dietary supplements. So about 60 to 80% of people use vitamins and minerals, 25 to 75% use multivitamins, and about 25% use herbal and non-vitamin supplements. And the challenge with the use of dietary supplements is there are, very limited studies on using dietary supplements when patients are undergoing cancer treatment, and most of them are kind of early phase studies or perhaps done in kind of mice models or clinical or lab settings. So we don't know a lot of the time if they're safe in kind of human studies. So we know that some supplements can cause harm, and this is always what me as a physician, I always try and avoid supplements that are going to cause harm. And so there are certain supplements that were tested in the past and actually have shown harm in very good, well studied trials. So for example, there's a supplement called acetyl L-carnitine. And this is a supplement that has been shown to help with diabetic neuropathy. So when people develop diabetes and they've had it for a long period of time, they sometimes get that numbness, tingling in their fingers and their toes. They might have decreased sensation. And so, there was a trial several years ago saying, well, why don't we try and use this to see if it can help with chemotherapy-induced peripheral neuropathy? And actually, so they randomized patients to this supplement and to nothing at all. And the patients who actually received the supplement actually had worse neuropathy compared to the ones who didn't have anything. So that actually caused harm. So we're very careful about things like that. Similarly, there's been some studies that using antioxidants before or during chemotherapy treatment for breast cancer may increase the risk of the recurrence by up to 40%. And it's theorized that perhaps because chemotherapy is essentially trying to eliminate eliminate kind of reactive oxidant species, and we're trying to, and then the antioxidants are trying to, prevent that it might actually render the chemotherapy less effective. And therefore, perhaps that's why in this study, the risk of recurrence was so high in the patients who are on antioxidants. And then there's a good study from several years ago for patients who were smokers and who took this supplement called beta carotene. That supplement was thought to actually increase the risk of lung cancer in patients who smoked by about 18%. So those are some cautions where we think it can cause harm. The other aspect about why we worry about supplements is that they can have interactions with chemotherapy and hormonal treatments. So one particular enzyme inducer is called CYP3A4, and a lot of chemotherapy drugs are metabolized through this pathway. And some herbal supplements can actually induce this pathway more. So it can actually increase the bioavailability of that chemotherapy and increase the side effects of that. So some of those examples are St. John's wort, echinacea, and grapeseed. And then on the other hand, some herbal supplements actually inhibit this pathway. And so it might reduce the effectiveness of some chemo and things like that. You might have heard of, grapefruit juice, maybe if you're on a certain type of chemotherapy or targeted treatment, to not take grapefruit juice while you're on that. Similarly, golden seal and Asian ginseng have been noted to be inhibitors of this pathway. And then similarly, other supplements have been tested and they didn't actually show a benefit. So one supplement called guarana, which was tried in cancer-related fatigue, and they tested this in patients, and it actually did not reduce fatigue in patients undergoing cancer treatment. And that was looked at across kind of multiple studies in a meta-analysis where they kind of combine all the studies and they see if they can find if there's any effect. Similarly, that supplement that I just talked about, the acetyl L-carnitine, was also looked at for fatigue, and it didn't show any improvement in reducing fatigue. And you might say, well, if it's fine if it doesn't show an improvement overall, but I think sometimes we forget that the cost of these supplements can be quite substantial. And certainly in some of my patients, thousands of dollars are being spent on supplements, which, may not be effective or may not be working. On the other hand, there are some, potential promising supplements that are currently being studied. So there's a study going on right now of high dose vitamin D in patients with colorectal cancer. And an earlier phase study actually showed that high dose vitamin D, so I think it was about 8,000 units of vitamin D, actually showed the progression of the cancer in patients who already had stage 4 colorectal cancer. And it didn't really have any side effects to that. So that is something that's, potentially promising in that setting. And then probiotics can also be interesting. I think we know that they can be quite beneficial for patients who get diarrhea when they're on chemotherapy. In patients who are on immunotherapy, there's, the jury is still out on that. So I would be a little bit cautious about probiotics in immunotherapy. There was one study out of MD Anderson that showed that, it might reduce the amount of your gut microbiome, and patients who are on those actually didn't have as good benefit from their immunotherapy as compared to patients who were not on probiotics. So how should you kind of think about approaching, dietary supplement use, and how I kind of talk to my patients about it? So what is the purpose of taking the supplement? So a lot of times when I ask, my patients, it's to improve my immune system, or it's to fight the cancer. And so we need to kind of look into those details. Are there studies that are actually showing that? And where did you get kind of that information from taking that particular supplement? Was it a friend or family member that recommended it to you? I also like to ask who the manufacturer is. And, some studies have shown that, even though a particular supplement says that it contains a particular substance, when they've actually done some studies on it in the lab, it actually doesn't contain that substance at all, or it contains much less of it, and maybe perhaps some other substances. Similarly, like I said, what kind of studies have been done on this supplement? Are they preclinical studies? Are they studies that have been done in mice? Is it, a small case series where, 3 or 4 patients were given this supplement and, their cancer improved? Or are they kind of, what we like to see ideally is kind of a randomized control trial where we're controlling for everything. We have the same, type of patients in 2 groups, and then we put in that particular supplement and we look at, the differences between those 2 groups. Another question to kind of look at is what are the side effects and the interactions of that supplement? Is it safe to be taken with the particular chemotherapy or targeted therapy or immunotherapy that you're taking? And are there safer ways to achieve the same effect? So perhaps, if it's for improving your immunity, we know that exercise can actually improve your immunity. We know that eating a well-balanced diet can improve your immunity, and mind-body therapies, when they do kind of the science studies on that, which I'm sure Linda can tell you, also have really beneficial qualities on inflammatory pathways and immune function. So these are some useful websites on dietary supplements. So the first one is Memorial Sloan Kettering Cancer Center's About Herbs. The first 3 are kind of at no cost, so you can literally go on these websites and kind of investigate for yourself. And then there's a few kind of databases like Natural Medicines that have an access fee. We're able to look at it at AHS because AHS subscribes to it, so I often use that to kind of make sure that there are no interactions. And then other things like Up to Date and Consumer Labs also have a bit of an access fee. So yeah, that's kind of our presentation, and looks like we still have about 30 minutes for kind of discussion, questions. These are contact information for Dr. Carlson. I can put mine as well in the chat. And then the Action Center is a really good website. This is the Alberta Complementary Therapies and Integrative Oncology Center, which Linda started several years ago, and the whole Integrative Oncology program and the clinic is part of that. So would encourage you to check that out, and hopefully there will be a new space in the new cancer center dedicated to integrative oncology. So we're excited to be part of that.
So I take it on the slides, but if anyone wants us to go back to anything that we've covered, they're happy to do so. And we can certainly send a copy of those slides to Nikki for distribution afterwards.
Thank you, Linda. And thank you, Sophia. An incredible amount of really impressive information. And I do feel like we need to have you guys back every 6 months or so because the research keeps coming out and keeps changing. So I'm going to stop the recording now, and